Welcome to This Explainer. Today, we're zeroing in on a sudden, severe medical issue that sends literally millions of us to the clinic every single year. Yep, we're talking about strep throat. Picture this. You wake up and your throat is absolutely on fire. I mean, swallowing feels like literal razor blades. Or maybe your kid comes home from school complaining of the exact same thing. In that moment, you're probably wondering, is this just a standard bug I can wait out, or something that needs a doctor right now? Well, if you've been there, you definitely aren't alone. The CDC reports that Group A streptococcus, the bacteria behind all this, causes between 5.2 and 5.9 million outpatient visits in the U.S. every single year. So it is incredibly common. Here is our agenda for today. We're going to cover 1. Is it strep throat? 2. The rapid testing process. 3. The antibiotic solution. 4. Your recovery timeline. And 5. Kids, adults, and recurrence. Let's jump right in.
Starting with Section 1, is it strep throat? First things first, we've got to figure out exactly what we're dealing with when that severe pain hits.
So, strep throat is a bacterial infection caused specifically by Group A strep. This is key because it operates completely differently than a standard viral cold. Since it's bacterial, it absolutely requires an antibiotic intervention to stop the spread and dodge some pretty serious complications. Basically, it's not something you can just tough out. And you can really see the difference when you compare strep to a regular virus. Strep hits you like a freight train. Boom! Sudden severe sore throat, a fever spiking over 101, swollen tonsils with maybe some white patches or streaks of pus, and those telltale tiny red spots on the roof of your mouth. A viral infection, that usually creeps up on you with a gradual cough, a runny nose, or conjunctivitis. Rule of thumb, if you're coughing and congested, it's probably a virus. But sudden, high fever throat pain without the cough, strep is your prime suspect. Moving on to Section 2, the rapid testing process. Since symptoms alone just aren't enough for a rock-solid diagnosis, let's see how things actually work at the clinic. The good news here, getting an answer is super fast. First, the provider does a quick swab of the back of your throat and tonsils. Then they run a rapid antigen test right there in the room. In just 5 to 10 minutes, you can have a positive result. Now, if it comes back negative, but they still strongly suspect strep, they'll send a backup culture to a lab. That takes about 24 to 48 hours, but it's highly sensitive and will catch anything the rapid test might have missed. Which brings us to Section 3, the antibiotic solution. Got that positive test? Okay, time to immediately go on the offensive. The go-to first-line treatments are penicillin or amoxicillin. Fun fact, Group A strep has actually never developed a resistance to penicillin. You might take it as a pill for 10 days or even get a one-and-done injection. Amoxicillin is hugely popular for kids, mostly because it tastes way better and comes in a liquid or chewable form. And hey, if you're allergic to penicillin, no worries. There are excellent alternatives like cephalexin, a quick 5-day course of azithromycin or clindamycin. And here is exactly why getting those antibiotics matters right away. Just look at this contrast. Without meds, you are out there actively spreading infectious respiratory droplets for up to 3 weeks. But with treatment, you're literally no longer contagious after just 12 to 24 hours. That's a massive difference. And it's exactly why schools mandate at least 12 hours of antibiotics and 0 fever before sending kids back to class.
Oh, and a quick practical tip for your house while you're in that contagious window, wash your hands constantly. Don't share cups, and this is a big one, throw away your toothbrush after you've been on meds for a full 24 hours. You definitely do not want to reinfect yourself with the very same brush that housed the bacteria on day 1.
Now, this next part is absolutely crucial. Even if you feel totally amazing after 2 or 3 days, you have to finish the entire course of medication. Stopping early just lets the surviving bacteria multiply. That can cause a relapse or honestly lead to some terrifying complications like rheumatic fever, kidney inflammation, or insanely painful throat abscesses. Seriously, finish the meds. All right, Section 4, your recovery timeline. The antibiotics are in your system, so let's track how you're going to bounce back. Most people see a really predictable, satisfying pattern. Within the first 24 hours, day 1, your fever starts to drop. By days 2 and 3, that awful throat pain decreases noticeably. Your energy comes back and you feel pretty much normal again. Hit days 4 and 5 and symptoms are largely gone, leaving maybe just some mild irritation. And by days 7 to 10, you finish the meds and the infection is completely history. Finally, Section 5, kids, adults, and recurrence. Let's look at who gets hit hardest and what to do if this bug just won't quit. So, strep is definitely most common in kids between 5 and 15. And interestingly, they might get unique symptoms like stomach pain, vomiting, or even a rough sandpaper like scarlet fever rash. But adults, we can absolutely still catch it. And while our throat symptoms might actually feel milder, the risk for severe complications is way higher if left untreated, especially for anyone with a weakened immune system. But for a few unlucky folks, strep just keeps coming back. Maybe it's a persistent carrier in the house or incomplete antibiotic runs. If you hit 7 or more episodes in a single year, well, you've crossed a major clinical threshold. If you or your kid hit that threshold 7 times in 1 year or 5 times a year for 2 years in a row, your provider is probably going to refer you to an ENT specialist. That's when the conversation shifts to a tonsillectomy, literally removing the tonsils entirely to finally break that cycle of infection. We've seen just how different strep is from your run-of-the-mill cold, the speed of that 5-minute test, and why finishing those antibiotics is non-negotiable to protect your vital organs. So I'll leave you with this. The next time you wake up feeling like you're swallowing razor blades, are you just going to shrug it off and wait it out, or are you going to take immediate action to stop those bacteria in their tracks?